Hello, guys. This is Al. I again wanted to talk about a little bit inside of the residency. Therefore, there is some part of residency that they call dosimetry. Basically, you wanted to learn treatment planning. Therefore, really is important. If you look at any software that they use in the radiation oncology department in the dosimetry for doing, including Pinnacle, Monaco, Eclipse, Ray Station, and you wanted to make sure that you have every steps to learn treatment planning. Before, some of us we don't have really treatment planning background. Some of us in the school they taught us or they work with us. Therefore, imagine that we don't have really uh, any treatment background and we wanted to work with the dosimetrist and learn from the dosimetrist. Therefore, the first important things in treatment planning in dosimetry is contouring. Therefore, unfortunately, in the school, most of the school they teaching you physiology slash anatomy slash physiology, and they don't really go deep into that. But when you go to the dosimetry and wanted to start dosimetry, other than knowing the software and how exactly works, you wanted to make sure that you can actually delineate and draw the targets and OAR or organ at risk, and to make sure that you know where you should start that organs and when you should end which is slice. Therefore, really at that point you need a very nice CT sectional anatomy. And also there are a couple websites like NRG, oncology.org or RTOG .org that they give you some hint, and there are some websites like e-contouring or brain, head and neck, all one word .org. These are the website that you can work, but still there are some things that you should study and make sure you know everything, like upper extreme head and neck, upper extremity, chest and abdomen and pelvis and lower extremities. Where you wanted to make sure that in the beginning of that rotation, before you go around yourself and see what the heck I'm doing, make sure you know how to contour. Therefore, that is the most important thing before anything else. The second thing is most of us start with the 3D planning. For treatment planning and 3D, there are some curative, but lots of them also is palliative treatment. Therefore, we are not going to use VMAT or IMRT or DCAT. We basically using the just one field or two fields, AP, PA, which is anterior, posterior, anterior, depend on that the patient how lay down on the table during CT simulation, or the three fields, one AP, two laterals, or one PA, two laterals, or four field, AP, PA, right lateral, left lateral. Therefore, after that is going to the deep to the physics, because you wanted to know what is the dose distribution is for each of these field and have the idea how exactly this dose distribution work, and then how with the weighting of each field you can very subtly move the isodose lines. We can talk about it too, and how you can use some treatment aids like your wedges, how the wedges affect, for example, our dose distribution. Because before, in the old machine, we had the physical wedges that therapists were placing in the head of the machine. Now we have universal wedges that's already been implemented in the machine. For example, in the machine that I'm working with, this wedge actually is after ionization chamber, after the first collimators, and then you go flattening filter and a scatter foil, and then a flattening filter, ionization chamber, and wedges that help you for the iso dose lines, and then how you do the dose distribution for that field that you want to work with. Therefore, this learning physics and looking at the good books like a Khan, or even in the Google image, you can find lots of good slides. Just put like a 3D field dosimetry radiation. Therefore, all of those things is super important, and you definitely should pay attention to that. And we talk about it more in details, and please subscribe for the channel. Thank you for everything, and gives us thumbs up, and have a wonderful day.